Wonderful. Well, we have a really nice program for you tonight. What you can expect is that you're going to hear some information, of course, about CADASIL itself, why we're doing the research, who's eligible to participate, where this research is taking place, how research visits are structured. And then you're also going to have a special treat by hearing from 3 CADASIL study participants themselves to hear about their experience and their thoughts. And Megan Caruso will introduce them a little bit later on in the program. I should also note that all questions and Q&A is going to be held at the very end after all of our speakers have had a chance to present. All right. Dr. Salloway, would you be kind enough to share some of the slides, at least the opening slide?
Yeah, well, thanks so much, Tara. And thanks everyone for joining, and especially to everyone who's participated in the study so far, and for our study participants who will be sharing in a few minutes. We're all going to be sharing some experiences we've had with CADASIL, some more personal than others. I thought that it might actually, as we were preparing for this, I thought back to my own experience with CADASIL, and we saw our first CADASIL patient at Butler Hospital at Brown University in Providence in 1994. And I had a lot more hair at that time, and it was darker than it is today. And I had a grandmother with dementia, so I was especially sensitive to trying to understand what causes people to have cognitive difficulty. And I began studying small vessel changes in the brain. And it was at that time I was referred a patient for an additional opinion. She was in her 50s, and she was a housewife, lovely woman who had 4 young adult children. And she had depression and cognitive difficulty and had a lot of white matter changes on her MRI scan, and had actually underwent a brain biopsy at Mass General Hospital. And they had diagnosed her as a condition called Binswanger's disease, which is closely related to CADASIL. And she had a family history of multiple sclerosis. But she didn't have any really risk factors for Binswanger's. Usually it's associated with later age and hypertension. And so we took a closer look at her biopsy. And at that time, there had been a report of familial small vessel disease from France. And I was wondering, gee, could this be, and it didn't really have a name at that time, but could this be that condition? And at that time, it was a lot different than it is today. The group in France only sequenced a small part of the gene where mutations had been found. And to send off blood, you had to wait at least 6 months to get the result. So it was a very different time. It was not a standardized test by any means. And not surprisingly, it turned out she had what became known later as CADASIL. And so this was our first experience, and we were very interested that this was a familial form of changes in small blood, something I'd been studying, but in a non-genetic way, that this was now a genetic form of this. And so we immediately started studying it and started working with families and encountering other families. And then over time, we've ended up seeing patients from all around the US with CADASIL. And we collaborated with, at that time, things were much more organized in France and Germany, where they had the whole country came to 1 or 2 locations. Patients with families with CADASIL would come to one place. And we actually conducted the first clinical trial where we tested donepezil, a memory medicine, for patients with cognitive difficulty with CADASIL, and actually showed some benefits in executive functioning with that medicine. And it was always my hope. So this study is really, you'll hear more about it, is really a dream come true, that we would form a network of CADASIL centers in the United States as they had done in Europe. And so that we could then get the most out of trying to understand what's going on and hopefully develop eventually new treatments, and combine hopefully with colleagues around the world. And we had a really good experience with a genetic form of Alzheimer's disease. We also had some families with that, actually very large families, who had a mutation that causes early onset of Alzheimer's. And we became part of a new network to study that form of Alzheimer's called the DIAN study, with others around the world. And that has just flourished. And so I'm hoping that this study will be the forerunner and build the foundation for future studies so that we can eventually develop new treatments. That would be the ultimate goal, and make a real difference against the disease. So the goal of tonight is really, and all the work we're doing, is to build community, to advance research, and really to work together in this effort, because we can't do this without you. And so this is something that we're all undertaking together. Now let's see if I'm going to be able, first cognitive test. Can I share my screen? Let's see. That's not the one I want. Just had it a minute ago. Okay, this one's not so good. I don't think that's the one I want. Hold on. Okay. Can you see that? Can you see my screen? Okay, good.
Yes, we can.
Okay. And Tara, did you tell people where to
Yes.
where to post questions? Okay.
Yes.
All right. So Tara already went over sort of the top line of what we're going to cover tonight. So this study is organized by University of Wisconsin and 12 academic medical centers around the United States to try to identify and track changes early in the earliest stages of CADASIL, and hopefully, as I said, build a foundation for treatment trials. And it's open to people who are 18 or older, and either who have had genetic testing for Notch3 for the mutation in CADASIL, or are willing to have testing, though you do not have to find out your results. The enrollment started last spring, and our goal is to enroll 500 participants, 400 participants who have the Notch3 mutation, and 100 participants who do not. And that group that do not are just as important as the people that do, because they're the control group for this study. And it's very important for powering any findings. I mentioned about the centers, and you'll see a map of those in a moment. And the study is funded by the National Institute of Health. Let's see if I can get the next slide. Okay. All right. So what is CADASIL? Let me get all my things out of the way. Okay, it's a rare genetic disease that affects primarily the small blood vessels in the brain. And it's caused primarily by a single gene mutation. The name of the gene is the Notch3 gene. It's on chromosome 19. There's different variants. Some are more pathogenic than others, but typically what we're looking for in genetic testing is, does someone have a form of the gene, a mutation that is likely to be disease-causing? Sometimes it's a little less clear, but we're trying to identify the genes that are most likely to be causing the disease. It's a funny name, CADASIL, and it stands for cerebral, which means the brain. It's affecting the brain. Autosomal dominant, which is the inheritance pattern. Arteriopathy is the small blood vessel disease. It affects primarily the blood vessels in the brain, and to a much lesser degree, other organs in the body. And see if I can get this, move this out of the way. And it affects the vessel walls, and it causes the wall of the blood vessels to gradually break down over time. That's the main problem, which then leads to two kinds of changes in the brain, or three kinds of changes. Small strokes, those are the subcortical infarcts, and leuco, or white matter encephalopathy, softening of the white matter. So the connections between the nerve cells start to break down. And we can see that those changes on the MRI scan. Okay, so in terms, it is a genetic disorder, and the pattern of inheritance is passed down from one generation to the next. If you have an affected parent, you have a 50-50 chance of inheriting the abnormal gene. It's very uncommon to have two abnormal genes. Each person usually, if there is a mutation, it's usually a single mutation. So you receive one copy of the Notch3 gene from your mother, one copy from your father. If there is a mutation there, it would be a 50-50 chance of inheriting the mutated copy. There can be mutations that can just occur spontaneously. They're called de novo mutations. They're very uncommon. It's almost always inherited. Now, what are the symptoms of CADASIL? And it can vary quite a bit. About 40% of people have trouble with headaches. And the most common form of that is migraine with aura. And aura means that there's extra symptoms like visual changes or numbness, sometimes even more prominent symptoms of weakness or confusion. Sometimes the headaches are milder and more like hard to separate from tension headaches, but usually it's a migraine type headache. Later in life, and this is what makes it a little hard living with this condition, it's really unpredictable when symptoms will occur. But small strokes can occur, and that tends to occur later in life, less likely earlier on. There can be difficulty with cognition, especially executive functioning, organizing, thinking, planning, trouble with behavior change, getting a little more irritable or depressed or impatient or less motivated or a little more moody. Seizures can occur. They're not very common, but they can occur. And certainly episodes with brief periods of confusion can occur, especially as someone gets older. So the study is designed to characterize, this study is designed to characterize the initial presentation and the course of the clinical symptoms, the changes on MRI, changes in blood biomarkers, additional analysis of the impact of different genetic forms different mutations might have, clarify the health and lifestyle factors that can affect outcomes, and there will be special sequencing of genes and larger scale sequencing. We're going to try to use modeling analytics to analyze all the data to try to get a better sense of what's going on in CADASIL and see how that might apply to other types of vascular cognitive impairment. And again, having the network should be very helpful, one, to have the infrastructure to conduct additional research, which could eventually include treatment, and also to identify different targets and outcome measures for treatment trials. So eligibility, people need to be 18 or older, have genetic testing for Notch3 or willing to have genetic testing, willing to commit and complete 3 in-person visits and remote visits by email, phone, or Zoom. Willing to commit to a brain MRI and blood draw at each visit. Be medically stable and have no conditions that could affect neurological or psychiatric functioning, in addition to CADASIL. Have a companion who knows you well, knows the person well, and can provide additional information. And for this study, we're limiting it to individuals living in the United States, Canada, or Mexico, people who can travel to US sites. And here you can see the different centers that are participating in the trial. So large areas of the country are covered, but a lot other areas are not. And some people are going to have to travel to get to a site. And we totally appreciate people doing that. Hold on. Okay. And I think I'm turning this over to Megan Caruso, who's the very able coordinator at our site and knows a lot about the logistics of the study, and she's going to go over the nuts and bolts of the visits.
Hi guys, my name is Megan Caruso. Like Dr. Salloway said, thank you for talking a little bit, by the way. I'm the coordinator at the Brown Butler site. I've met and worked and talked with some of you, and I'm so thankful for all of you guys participating and also for you being out here tonight. And I'm going to illuminate a little bit more about what the study actually entails. What are your responsibilities while you're here? So while you're participating, it will involve about 3 in-person visits. So each visit will be 18 months apart. So you'll have your initial baseline visit, and then you'll be back at the site a year and a half later, and then a year and a half later after that. So each visit is pretty long, but we are expected to get all the activities done in a day or two, and then you don't have to, while it is a pretty long day, and we won't have to see you after a while. Can you continue? All right. So during each visit, you'll be asked some questionnaires. So this will be kind of getting to know you better about your demographic, health history, medications, activities, and stuff like that. And then you'll be also getting a neuro exam. So this will be done by a clinician, and we'll be looking at your strength, coordination, mobility, reflexes, things like that. You'll also be undergoing a lot of cognitive testing during the day, about 2 hours worth. And I think it's kind of like brain games. I like to describe it as you're going to be working out your brain that day. You'll also be doing a fasted blood draw, which is only about 3 tablespoons of blood. We do ask that you fast prior to do it. I know at our site, we like doing it first thing in the morning so we can get you breakfast right after, so you're not hungry for too long. And then we always end the day off with an hour brain scan. So on cognitive testing, this might not be familiar to everyone. And like I said, it's kind of like brain games, and we'll be looking at you completing tasks to assess your attention, memory, thinking, things like that. So you might be asked to name objects, repeat some phrases, numbers, or even draw some figures. So this is an example of one of the tablet-based tasks. We both have paper and tablet-based tasks that you'll be asked to complete. For this, we're looking at your motor skills, and we're looking to see how fast you can tap this green square in 10 seconds. So the MRI, this might be a big, if you've never had one, it might be daunting. If you have had one, you might not like it very much, but it is part of the study because it gives us really important information about, brain changes, especially over time, since it's a 3-year study. So an MRI scanner is a large machine that contains a hollow tube and takes pictures of inside your brain by using magnets. So it lasts about an hour, which you would lay very still. I've had about 75% of my participants fall asleep during it. And it will make some noises when it's taking those pictures of your brain. You can also communicate with the staff during the MRI. So if you don't feel comfortable at any point during it, you can always get out. So possible research visit schedule. You might be consented at the beginning of the day if you're not doing it online beforehand. Then you'd get your blood draw. We'd provide meals. You'd do some questionnaires about your health. We'd have some cognitive testing, a neuro exam, and then finish off the day with a brain MRI. I know at my site, I've been doing about an hour and a half Zoom call beforehand to get the consent process done out of the way earlier and some of the questionnaires so that, you know, the day actually in person is shorter. And from what I've seen so far, I think that works out pretty well for participants. So what's the role of the co-participant or the study partner? So we ask that each participant has a study partner who knows them well, who can answer some questions about the participants' thinking, cognition, and mood. This just allows us to get an additional perspective of what you might be experiencing, just so that we can have a more well-rounded picture of, you know, what's going on. All right, some frequently asked questions. Can you participate if you are pregnant? Yes, because we have people age 18 and up. We might have people who are childbearing age. You can totally participate. The only thing is we're not able to do the MRI scan while you're pregnant, so we just wait to do that aspect until after. Will you be paid for participation? Is there a cost to participate? You'll receive up to $300 across the whole study, $100 per in-person visit as a stipend to thank you for your time and effort. And there'll be no cost for any of the study activities or procedures, including the genetic testing. We'll also, you know, if someone's coming and traveling from far away, we'll either arrange travel for you or reimburse the travel. And if you don't think you're eligible, but you're unsure, please reach out to us because there's a chance you might be. So, you know, the worst things we can say is no. So if you're willing to complete Notch 3 genetic testing, but you don't want to learn your results at this time, are you eligible to participate? I totally understand this might be something difficult. It is a very difficult decision to make. So we do allow participants to be in the study and get tested without ever finding their results. So they would still attend the genetic counseling session. However, you have the right to not learn your results. This will not be go into your medical record, or your insurance will not have access to these testing results, and your site coordinator won't even have access if you don't choose to. We believe that, you know, if you're participating in testing, you should have the agency over who gets to decide to see those results. All right, so if you want to participate, how do you get started? So contact the study team, the easiest way, especially if you're not sure where your local study site is to call our call center number that's down here, or email us, or go to our website. The call center will then connect you with the site that's nearest to you that is up and running, and then the site will reach out to you to schedule your visits and, you know, get things going. Right, and those are our investigators. And that's our social media. And coming to the star of the show is our participant panel and Q&A. So I've had the privilege of meeting many lovely individuals during my time as a coordinator so far, but I've asked 3 of the participants to share their stories and experiences, both with CADASIL and the study. So I want to introduce Bobby, Mary Beth, and Melissa. They're going to share a little bit about their experience, and you guys can take it away.
Okay, well, I will start talking if you don't mind, Megan. First, I'd like to say thank you all very much for having me on here. Thank you all very much for joining to learning more about this. To all of the study coordinators, thank you so very much for putting this together. I think so many years now being in the CADASIL community, to now be able to call us a consortium and have the opportunity to volunteer and to put the time into looking for what I think most of us would really like to see sooner rather than later, and that is better treatments and to understand the disease a little bit more and what is affecting it, and answer the questions. So my particular experience with CADASIL started when I was very young, maybe 9 or 10 years old, when my grandfather got sick, and nobody knew when this was. This was well prior to 1994, Dr. Salloway. So they were still grabbing at straws as to what was going on, and it was understandably not fun. Well, did not think much about it. No one in the family did until about 20 years later, and my dad got sick. So that was right around the time you were talking about there, Dr. Salloway. A couple of 4 or 5 years later, he started his symptoms, and that's when we found out about CADASIL. So in the early 2000s, my father was tested, me and many of my family members were tested. Many of my family members opted not to and still have not. So we definitely understand why people would or wouldn't. But I found out at that time in the early 2000s that I was positive. And amongst the various emotions, the first thing that I thought about was, first thing I thought was, oh God, oh God, oh God. But the second thing I really started to think about was, what does this mean? How does this help me? Help me prepare for the future and make the decisions going forward, because we knew it was genetic, and now I had the information to start making some of those decisions. I guess you could tell me that living healthy and taking care of yourself is something you want to do regardless of the test results, but this was a way to know. But again, a lot of people didn't, a lot of people don't, and that's fine as well. So what I did during this journey, and what kind of informed me when I found about this study that I wanted to join this, is I did start early joining Cure CADASIL, reaching out to the community, trying to stay as involved as I could, making sure that I was connected to some of the best neurologists that I could get to. Made several visits to Brown to see many of the team members that are here, and I figured the least that I could do was stay in the promotion, advocacy for the disease, and then anytime I had the opportunity to be a subject in studies like this and to join the consortium, I would do so. So that's what brought me here. I learned about the study through Cure CADASIL. I signed up and was very eager to join for all the reasons I just mentioned. But I think the biggest driver for me, and hopefully many of you guys can understand this too, is we've got a community here. As small as it may be, it's still a community, and we are we are the subjects, we are the patients, we are the people who have the answers, literally in our bones and our cells and various other organs that are there. But we have the answers. So I jumped on the opportunity. Joined up with Megan, went into Brown, had a great experience, although it was a bit of a long day. But in the end, I remember sitting and talking to a panel of which Dr. Salloway was on that, and asking the question many of us want to know, and that is, well, where are we with treatments? What's the cutting edge? What's the latest research? What's going on? And Dr. Salloway leaned in and said, it's you. It's you guys that are here. It's you people in the consortium that are, pushing us to come up with these treatments, and providing your time and your energy to help us find that. So that's how I found it. That's how I've gotten here, and that's why it's important to me, and that's why I volunteered. Even if the treatment doesn't come as quickly as I would like it to, it's very much like planting a tree that you may never sit in the shade of. You do this for everybody in your family, for everybody that is going to come after us. The little things we can do. And I'm not a scientist, I'm not a medical doctor, but I can sit in an MRI machine and take a nap for a while, as Megan said. So again, thank you for letting me talk. And anybody who's on this call, if you have questions or concerns, or you ever want to reach out, follow up on this, or just talk, I'm always available. So I think I'm supposed to pass it to Mary Beth, who is currently on my left. So
welcome. And I also echo all of your thank yous. It's wonderful to see so many people that have such a commonality. And my story is different. But when my grandmother was 57, she passed away of her second known stroke. And I was 8 and didn't get all of that. And then her brother out in Missouri had what was diagnosed as MS. And when he passed away in 97, he donated his brain to the University of Washington in St. Louis. And it came back to the family that it wasn't MS. It was something called CADASIL. They were like, what? And it wasn't really heard of. And started doing some research. Not me, I was still young, well, younger at the time, but my aunt, so my grandmother's daughter, she started having strokes, and she was tested for CADASIL at CHOP in the Children's Hospital of Philadelphia. And for some reason, as an adult, and she was positive, and she has since passed from strokes. So my dad's in the same position, and it started for him when he was 70. He had his first stroke, but never wanted to be tested. He was under the incorrect notion that it's 50% chance you get CADASIL, and because it's his sister and him, she had it, she was 50%, so he's all good. And it wasn't the case, as we know. But he also then chose not to be tested, even if his misconception was correct or incorrect, because he didn't want to spend the money only to be, he felt like he was paying to worry. So it's suspected, his neurologist has said, yes, we're pretty sure that he's got CADASIL. So time goes on, and I was 55 this summer, and as I said, my grandmother passed at 57, so I was faced with my own mortality, and am I just waiting for it to happen? What do I need to know? And I felt like knowledge is power. If I could somehow find out and then tell my children, who are now grown men with girlfriends who might be getting married and having children, how do I go about this? Because I didn't think I could afford to be tested. So I think Facebook was listening to me, because all of a sudden Facebook popped up with the CADASIL group, and I'm like, oh, I'll join that. And I started reading. I read about caregivers. I was sharing it with my stepmother. I was reading about people's personal journeys. And I posted one question. I asked, anyone have tips with how I get insurance to pay for my test? And a few people answered me and said, join a study. I'm like, okay. So I Googled that, CADASIL studies, and the consortium popped up immediately. And I filled out a form, figuring, I'll probably hear back in a few months, and maybe a few weeks if I'm lucky. And Ivan emailed me that day within about 20 minutes. So I then ended up calling him. We spoke on the phone, and I had not been tested. So I felt like, oh, this is self-serving that I'm signing up so I can get tested. But it was a dual serving. I was also serving a population. So then he said, you want to go to Columbia? That's closest to you. I'm like, I kind of wouldn't really, I'd rather not. I don't want to drive to New York City. And he said, Mara, where do you want to go? Well, I had seen in the show Providence back, I guess it was probably in the 90s. I'm like, I want to go to Providence. He said, okay. So he put me in touch with Megan, and flew up there in July. And again, I feel like it's still self-serving. I was on vacation. I got out of here. School had just ended. 2 nights. I got to go in a hotel, hang out with Megan. I didn't find it a long day, but I think we'll get to our actual daily events in a little bit. And I was tested. It was when I got back, and it was a very, very long 3 weeks. Spoke to a genetic counselor, which she explained it to me in terms that I could understand, the autosomal dominant characteristic. And she called me back in 3 weeks and said, this is your last chance. Would you like to know what your results are for the Notch 3 mutation? And I couldn't breathe. I said, I can't breathe, Claire, but yes, I do want to know. And it turns out that she told me that my results are negative. And I'm participating 100% in this study, because if I weren't negative, I needed people to be in the study to help me and to help my possible descendants. So I'm staying in as one of those 100 so that I can help your descendants and people that we haven't met yet. And at first I thought, 5 years, that's forever. But I don't think it's going to feel like forever once it happens. So that's my story. And I appreciate that you're here and for listening to my story. And I'm going to hand it off to Melissa.
Hi. So my story is a little different. I'm the first person in the family to discover that I do have CADASIL. I have had a genetic test, and I got the results from a prior neurologist. but it started in 2007, if I'm correct. I felt like I was having the symptoms of a stroke. So my husband took me to the emergency room and they thought that I had MS. I was there for like a week. They did all kinds of tests. They sent me to a neurologist, and I did a bunch of other things that showed that, well, I don't have MS and I feel fine. And it kind of just pittered away. They had put me on blood thinners for a little while, and then I never heard from them again. And then my daughter 2 years ago had a baby, and then 8 days after the baby was born, she had a stroke. So she, 32 years old, no, I'm sorry, 35 years old. And so I went to a different neurologist. They took an MRI, they did all the things, and they did the genetic testing and said, you have, actually, it was a terrible experience. He said, yeah, you have CADASIL brain, make an appointment, see me in 3 months. And he literally got up and walked out the door. So I had already done a little bit of research on what was going on. I knew, you know, of course, I was completely freaked out. And I figured, well, whatever. So I don't even really remember why I ended up switching my neurologist to Dr. Goldstein, but oh, yes, I do. Sorry. I was at the gym and I was doing some weight training, and all of a sudden my brain like snapped and I got all buzzy, and it never went away. And luckily my sister was with me, and we immediately went to the emergency room, and I had a brain bleed. Small, I'm fine. You know, you're looking at me. I get a little bit of numbness on one side of my body. My fingers are numb. But other than that, I'm good. They told me to try to keep my blood pressure low. And, you know, I always say, enjoy yourself. It's later than you think. So that's kind of where I'm at. And I figured I'd join the study because somebody in my family had it, one of my parents that we did not know about, and they both died mid-80s. And I'm the youngest of 8, so I'm the only one that's presented with anything like this as of now. And I have 3 children, and I know one of them most likely has it according to her brain MRI, but she has opted to not find out whether she actually has the genetic mutation or not. As far as the study itself went, that day, you know, it was easy. Megan's adorable and fun, and everybody was nice, and you know, it's just a day. It's not difficult. It's the building itself is also really cool. I can't imagine why anybody wouldn't want to go in and spend 6 to 8 hours to find out something that could help their family, their future family, and you know, hopefully find some kind of cure or I don't know, medication or something. So I don't really have much more to say on that, except, you know, get it together, people. Let's go.
Thank you guys so much. So you guys are great, and thank you so much for sharing your stories. I have a couple more questions for you, and maybe speaking from your experience, Melissa. You know, sounds like you didn't have a great experience when you initially found out.
Oh no.
What would you like to tell healthcare providers who have never seen a CADASIL patient in order
Well,
to?
you know, when I went into the emergency room, my last stroke, I said, I have CADASIL and I believe I'm having a stroke. And she didn't, you know, the woman at the front desk, she had no idea. The doctors that came in, one of them said, oh, I've heard of that. They're not very knowledgeable as far as CADASIL, and it's rare. So I guess I don't blame them, but I'm hoping that more people start learning about it. It starts to become part of the regular conversation with neurologists and all the medical people, I guess. So I mean, I'm assuming they would treat me the same no matter what stroke I'm having, but you know, I really don't know what to say to that as far as just more education.
Appreciate that. Also, as part of your experience participating, you also served as a study partner. Can you talk a little bit about the responsibilities regarding that?
With Jackie, with my daughter,
Yeah.
well, you know, she would answer questions that, and you know, say she hasn't had any changes, and I would either agree or disagree. She's been great. I haven't really seen any major changes with her at this point, and she doesn't feel like she's seen any major changes with me either. I've always had a terrible memory, but that's, you know, I don't know what that's attributes to. I have no idea. But
Would you,
go ahead.
sorry, would you say that it was a large commitment on your part to just do the study partner
Oh, no.
portion?
No, 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 not at all. It's easy, and you love the people that you're studying, you know, being a co-partner with, and you know, then afterwards we can go out and get some food and drink.
Perfect. Either Mary Beth or Bobby, would either of you like to talk a little bit more about the MRI experience?
Yeah, I can do that. It was quite easy. I know in the case of our study, it was right across the street, or we drove down a little bit there. So I don't know about the other facilities, but if you've been in an MRI, it is an MRI. It's quite loud, and it's you know, it shakes and you're in a little tube. But I wasn't joking when I said a 45-minute nap, because despite the noise, I don't think I've ever taken an MRI where I didn't fall asleep in there. But being towards the end of the day, it was actually kind of a nice to unwind and not have to play any of those, as you said, Megan, brain games, going through that whole process. But it didn't seem out of place. It didn't seem difficult. You understand why you're doing it. And on the theme of getting an MRI versus purchasing an MRI, I also like the fact that I get an MRI in that particular case. So, and then back for the rest of the day, when you look at the testing, there is my experience was, for those people who may be listening in to kind of either confirm that they don't want to do this, or to get themselves over the hump to maybe jump and participate, there was no part of the testing from the blood draw through the MRI that wasn't consistent with any other test that most of us have been involved in. It was a simple blood draw. It was you know, we got breakfast, which is always good, free food. You know, it was a series of games. It was a series of questions, and just like any other medical examination, you're just having 4 of them in the same day. So if you think about what it takes to get through those, if you had to go see different doctors, it's definitely much more compact. Little tiring on the brain side, but not overwhelming. And you know, you guys running the study did a great job making us feel comfortable, and you know, explaining to us what was going on and why we were doing it, and very, very communicative. So in that sense, it was a lot nicer than, sorry about your situation, Melissa, but then some of the doctors that you deal with that give you that and then 45 seconds later run away. It was a very welcoming, warm, and perfectly good experience, I guess. I don't know. What do you think, Mary Beth?
Yeah, Megan, and Bobby, if I could just jump in on the MRI, I would just give people some strategies. You don't even know that you're in a tunnel if you close your eyes before you head in.
Yeah.
So, and just knowing that you've got that call button, it's almost relaxing. So as long as you close your eyes, and then Megan or the technician, they put something over a plastic piece over your face. And in my experience, just don't look. And then you go in, and maybe 10-15 minutes, Megan, towards the end, you'll be told that, okay, we're going to turn the music off, which, by the way, you have music on the whole time. So you hear the knocks, but it's not that bad. So they turn the music off, and then you have to open your eyes. And I'm thinking, oh, here we go. But there's a mirror in that piece that's over your eyes, and it was situated perfectly. My mind was tricked. It looked like I was sitting in a recliner. I could look at my legs and my feet, and I could see Megan and the other woman behind the plastic or the glass window. So it was perfectly comfortable. I just felt like I was in my living room. I was reading the signage that was on the walls. And the brain games, I can't wait to go back because there's a couple of questions now. I'm strategizing. I'm going to beat my score. But it was fun. The whole day was just fun. And the thought that people are learning about me and they're learning about this CADASIL, it was cool to me. So I'm excited to see you again in another year and a half, Megan.
Thank you guys so much. And looking at the time, I want to have enough time for Q&As. Would all of you guys, if you have anything else to say or have anything to put, why would, do you guys have any tips or pieces of advice for someone who's kind of apprehensive about participating, or they may be untested and they don't have it themselves?
It's obviously going to be a personal choice, and it's going to be difficult, and everybody's going to deal with it in their own way. But I think the way this, well, first of all, we're all part of the same consortium here. We all have the same goals in the end. Whether you can or can't participate, or you come to the decision to or not to, that's your own personal choice. But if you think about what we can do, and you think about the fact that the information is already inside of you, but you don't have to get the results if you don't want to. You can kind of tailor what you learn from this to your own personal situation. If you are close to saying yes, I would say dive right in. We'd love to help. And if, as I mentioned at the beginning, if you have any questions or any thoughts, or you want a little deeper understanding of what goes on, or how I came to my decisions, I'm perfectly fine if you reach out to anybody here and ask for my email address to get in touch. So whatever could do to help. So you guys.
I wanted to say, as a person who's very claustrophobic, the MRI, I was allowed to take an Ativan, give myself a little bit of a calm down before I got in there. So, and it was fine. It was absolutely fine.
I feel like, and I don't want to put this on you, but I feel like we have nothing to lose to give it a go and participate. Maybe a day, but you gain so much in that day. And I'm also willing to share my contact information. I guess, Megan, they could go to the Brown Butler site of the study and ask you for it, or do I put it out there now?
I'm not entirely sure about the privacy releases about that, but I'll consult the rest of the team after and let you know what the best course of action for that is.
Well, I'm on that CADASIL Facebook support group, so you could search for me in there.
All right, thank you guys so much. I think I'm gonna pass it along to Tara for some of the Q&As. If you guys have any questions, thoughts, comments, suggestions for future research or topics, please type them in there. We'd love to, chat with you guys and kind of make this a discussion.
Thank you all so much. Thank you, Bobby, Mary Beth, and Melissa, Megan, and Dr. Salloway. We do have a few questions in the Q&A that we'd like to share out right now. This first one is going to go out probably to Dr. Salloway, maybe even Dr. Paulson. This person is asking, the drug clemastine is currently being studied for myelin repair in patients with MS. Do you know anything about this? And if so, do you think it could help patients with CADASIL?
Yeah, that's a good question. To my knowledge, that drug is, well, there's no active drugs or very few for CADASIL at the moment. So that drug is not being tested for CADASIL, and I don't think there's a plan to test that particular drug for CADASIL. The good news about MS, and I can tell you I gave you a brief sort of synopsis of my history with CADASIL. When I was a resident and early on as a neurology attending, there were really no treatments for multiple sclerosis. It's a neuroimmunological disorder. We could give high-dose steroids when someone had a flare-up, which tamped things down, but still the disease kept going. And now, through treatment-oriented research, there are more than 20 treatments for multiple sclerosis, and it's much more treatable than it was when I was in training and early on in my career. So it gives us hope that we can open doors, hopefully, for other diseases like CADASIL, where there currently isn't a specific treatment, but hopefully there will be specific treatments down the road.
Wonderful, thank you.
I just want
as-
to add one quick comment. I went to the neurology meetings this year, and also, since I'm one of the primary contact for the consortium, just the amount of work we've done so far, I've already been contacted by 2 groups with a treatment who are wanting us to fill this cohort, and they're very interested in moving their treatments forward. So I'm hoping that just our activity, presence, advocacy, and raising awareness will bring more people like that forward, because the fact that we've already had 2, to me, was quite encouraging. So I did want to pass that along.
Well, that's good news, because I was also contacted by 2 companies as well. So, I mean, that's the whole purpose of this.
Yes. So we really want to say that we're successful, and I think we are, and let's just continue this, because that's awesome. If both of us had 2 contacts already, it's great.
Wonderful. Another question is regarding personality disorders, and this person is asking if this is part of presenting symptoms, however rare it might be. This person would like to know if it's still accurate.
And
Yeah.
I can take that one, but
Oh, go ahead.
Dr. Salloway, you go ahead first.
No, go ahead.
Well, the way the brain works, there's several components of the brain that are what we call gating mechanisms, where one part of the brain is very related to another part of the brain. And a lot of what our behavior does is directly related to the brain. So a lot of these so-called personality disorders are regulation, where you may think too much on something, have intrusive thoughts, be obsessional about something, or things that annoy you aren't regulated in the same way. So you have some dysregulation of irritability or anxiety or mood. And most of those are directly related to brain dysfunction. And so in my experience, it's more common than not that it is secondary to brain dysfunction. And the more that we learn about the brain, the more we're going to better understand how our behavior is so tied deeply to our brain changes, and hopefully be able to treat those specific components. And I'll also have Dr. Salloway address this, but in my experience, I have had many people come forward with brain dysfunction that you wouldn't think would have that presentation, but it does, because the brain is a very complex network and it has to work together. And it's very easy with just a very small lack of oxygen to an area or a very small bleed for a disconnection to occur. And so that can relate in a personality change or a dysregulation of either mood or anxiety or thinking styles. So Dr. Salloway, whatever else you have to add.
No, I think personality disorders per se are not that common, but I totally agree, Jane. Changes in mood or behavior or personality of some kind absolutely can occur, and especially over time. So yes, I mean, the changes, the places that are affected in the brain affect cognition, can affect behavior, can affect motor function, can affect mood.
Yeah, I would agree with that it's maybe better to say personality disorders isn't a term that I typically use at all.
Right.
But if that's been shared with you, that's someone else's background, and that may be the way they conceptualize it. But I would agree more with what Dr. Salloway said, that there's a tight relationship between our behavior and the brain.
Yep.
All right, it is amazing that we've already come to the top of the hour. I know there are several more questions that have not been answered, but as I said earlier, we will answer them separately after this webinar. I would love to thank our speakers tonight, Dr. Salloway, Megan, Dr. Paulson, thank you so much for joining. And of course, our absolutely fantastic participants for sharing their story this evening. Thank you so much, Mary Beth, Bobby, and Melissa. We hope you all learned so much tonight and that you have a wonderful evening. We look forward to hearing from you soon. Take care and be healthy.
Thanks, everybody. Thanks so much, Mary Beth, Bobby, and Melissa, and Megan.
Good to meet you.
Thank
You
you all
guys are
so
great.
much.
Yeah.